Welcome to the Roundtable Perspective. I'm your host, Tom Roach. I'm joined today by my guest, Bela Moté. Bela Moté is co-author of a report by the National Academics of Sciences, Engineering, and Medicines titled Closing the Opportunity Gap for Young Children, which highlights systematic issues in education and healthcare access that contribute to opportunity gaps for children ages 0 to 8. Why don't we start with that? What happens between 0 and 8? Why is this so important?
Well, thank you, Dr. Roach. Good to be with you and talk about young children, because what can be better? So the first 8 years of life, I think, as many of us know, are instrumental and foundational in how children learn and grow. In fact, the science is really clear that 90% of brain development happens in the first 5 years of life. So when we think about the potential for opportunity for children, the widest window that we have is really in their earliest days and years of life. And so this report really breaks down when there are barriers and opportunities that are lacking for young children during this really critical window. What happens and what can we do as a society and as a nation to ensure that those who face those opportunity gaps can still develop and learn and grow in the way that we know matters the most for young children.
And what are some examples of the kinds of opportunities that they should have?
Well, I think, anybody who's watching and, thinking about their own children, for example, we know that children need to have really good relationships, right, with the adults in their life, and it starts with their parents. But if parents are stressed, if parents are homeless, if parents are jobless, it makes it really, really hard for children to feel like they're in nurturing environments, right? Because the stressors of poverty are so much. If children are in environmental settings where the quality that they experience is not as high in the educational kind of rigor and the quality between the teachers, then we know that that's an opportunity gap in terms of their learning. If they don't have the right medical care, we know that that is a gap, right? So we know all of these different pieces can act as either vehicles for promoting quality and learning, or they can be barriers for quality and learning. And so it's not one particular thing that leads to a gap. It's actually like 3 different buckets. There's the learning bucket, there's the medicine and sort of the access to those good things, and then there's sort of the mental health piece of it. When you have barriers in all 3 of those things, the opportunity gap becomes even more heightened, and it becomes heightened for really young children. And so what this report tries to do is to say, look, we already know what the science tells us about young children's learning and development. What we have to do is to say, we know the science, we know what leads to opportunity gaps, what are we going to do about it? And the report tries to angle the conversation around 9 recommendations that we as ordinary individuals can think about together, we as collective society members can think about, and then we can really adjust state policies and national policies to start to think about the systems that bring the children into learning environments or medicinal environments or what have you to better for them. And so this report from the National Academies is really looking at the science and looking at how we can really start to distill that in concrete ways so that we don't have the kind of pronounced opportunity gaps that we currently have across our nation.
Okay, well, let's look at some of the recommendations then. Where would you like to get started?
Sure. Well, I think data is a really important one, right?
Okay.
We know, and we're sitting here in sort of, prime learning space at the university here, and we know how much data matters. But if you think about where young children access learning, where they go in terms of their neighborhood early childhood programs or a school setting that's offering preschool, the data isn't collected in a meaningful way. It's not centralized. No one can say, hey, little Johnny walked in here today and tomorrow he's leaving with X, Y, and Z, and that rolls up into a meaningful way for that child and several children to learn and grow. What if we had a centralized way to think about kindergarten readiness? We all talk about it, right? The importance of making sure that children come to kindergarten. What if there was a way that we can look at data and use that in a continuous improvement manner? So that's one of the recommendations that I think.
And what would be an example of how that would be implemented?
So I think thinking about a state or a national registrar that really looks at the different domains of development, right, that we know feed into healthy well-being.
A domain of development being?
So education, learning, right? So if you think about learning happens, you learn with your fine motor, you learn with your gross motor. What if there was a way to track children's development across these three pillars of learning and development that allows for people to say, how are our children doing, right, collectively across the nation? Instead of saying, hey, let me knock on Bela's door, let me knock on Dr. Roach's door and see what they're individually trying to do with children. And I think that that can go a long way when you have real-time data to say, you know what, in this particular area, we're not investing enough. In the physical health of children, we're falling short. But now we have data to back that up, and then we can be prudent in our investments.
Yeah. So how might they track that? What would that real-time data look like?
So I think that that's what we're having to think through together, right? There's piecemeal data. If you think about just our own experiences going to a doctor's office, right? We know that development, not only brain development, but physical development. Children in the first days, weeks, years of their life, you think about how quickly they're growing, right? Their weight, their height, but it's all in a place that doesn't connect to, well, if that child is underweight, how does that affect their brain development? If that child is homeless, right, or suffering some social emotional issues, so you don't look at that child in a collective way. So this data, you know, physical data lives here, educational data lives here, whether they're homeless or on WIC or food stamps lives here. So how do you actually start to make investments when you have to think about the hopscotch between the data? So I think that that's one thing that the recommendation says is there has to be a way to aggregate the data, but that it's meaningful for the people on the ground. So Carole Robertson Center for Learning is a direct service provider who works in a lot of the communities that this report talks about. How does it come to life so that we know little Johnny's underweight and has suffered homelessness, and so his learning might not be at the level it needs to be. Right now, I got to peel through a lot of paperwork.
And then you could track his progress.
That's exactly right.
I see three things they can be doing there. One is they can be setting up some criteria for what we're tracking. They could collect information that's already out there, and then they could be collecting some of themselves in addition.
That's right. That's right, because you always need sort of the sort of big picture data, right? You have to do good with the data. You don't collect data for just collecting data. It has to turn into something. So I think that's a recommendation. I think another recommendation is how do you really think about the way that you partner with families? Our education system, right, if you think about the K through 12 system, families aren't an integral part of the day-to-day learning, right? Children go to school, parents drop them off, they walk them to school, but in the first days and weeks and years of life, it's a very different kind of learning setting, right? So how do you actually create partnerships with families that say, hey, little Johnny's learning to walk here, are you seeing that at home? And what can we do together to reinforce that so we know that Johnny's literally steady on his feet, right? So I think oftentimes the parent or the family relationship is something that we don't lead with. And this report is saying, hey, they have to be in these early developmental stages. You have to have them alongside with you because those relationships that children have really make those learning outcomes come to life.
So somebody would interview the parents then as well, maybe, and try to be tracking what's going on at home as well as what's happening.
And there are, I don't want this conversation to sound like there aren't like good work that's happening, you know, in meaningful ways. What we don't have are good policies that promote that in a consistent way. And what this report is trying to say is, look, let's really try to think about all that we've learned in the field of early childhood education, all that we've learned about young children, the way that they learn and come to be in this universe and develop their identities, and let's be cohesive about it, right? And so I think that that's the difference between this report is that we're not focused on the science or the research of learning and development. We're actually focused on how do you take that science and research and do something actionable about it. And those are where the recommendations come in.
Yeah, and this would be an application step, obviously.
That's right. That's right.
Okay, take us to another one.
Sure. I think the other one is just thinking, how do you connect what happens in those early years and then transition that into elementary school? So what does the relationship look like between children who might have been going to a preschool program for their first couple of years of life, and then all of a sudden they're going into a kindergarten program, right?
Yeah.
What is the relationship between that school that little Johnny is going to and the center that they're going to?
As someone who went to 5 schools before high school, I can appreciate the importance of understanding that. So to what extent are we looking at those things already?
I think there's pockets of it, right? There's lots of good folks in different parts of the country that are really thinking about the promotion of some of these recommendations.
Yeah.
What I think is the greatest opportunity we have to close the opportunity gap is consistency at the national level. To say one of the recommendations is that early childhood education, high quality early childhood education that really fosters solid learning and development, is a birthright. Just like K through public school education, children are no longer denied that right to learn. Well, what if we took a step back and said, if 90% of the brain is developing in the first 5 years of life, isn't it a birthright for children to have access to the highest quality early childhood educational experiences? And shouldn't that translate that when they turn 5 and they go into kindergarten and they go into first grade and second grade and third grade when they're 8, right? That there's a way for that high quality, developmentally appropriate experience to travel with them. And as a nation, we don't have, a standard leave policy, right? That we've seen in some European countries, a parental leave, parental paid leave for a year. So we're trying to think about how do you create systems and structures that actually promote the well-being of children and really address the opportunity gap, both from sort of grass tops and really grassroots, thinking through that together.
So 2 things there, I think they're both worth pursuing. One is what we're doing to promote that development. So what kinds of things are we talking about there? And then the other is when we talk about tracking that and moving that information with them as they go forward, how does that happen? So, but let's start with the first question. I mean, what kind of experiences do they all need to have, basically?
So I think the experience is contingent on the people who are interacting with the kids, right? So we know that this field, the early childhood education field, has not invested in the workforce in the same way that the K through 12 system has, right? So they're not paid. The compensation and the benefits don't mirror what the K through 12 system. So how do you, I think I'm asking a rhetorical question, but if you think about the earliest days and years of life that matter the most in terms of children's well-being, and we're not investing in the workforce that actually is responsible, the brain, literally the brain builders, what does that say about us, right? And then when you think nationally, you think about movements that started in the 60s with Head Start programming. That is a federally funded program that was really earmarked for children and families that had less socioeconomic resources and met sort of the poverty threshold in America to give that child literally a head start into school. So this isn't unknown territory, right, in terms of really thinking about it. Where we fall short is the consistency of quality, the consistency of compensation, the consistency of training, and partnering with families to really make sure that every child blossoms, right? The way that we think about it, and by day, we're talking about the report today, but by day, I run a very large early childhood and youth development organization called the Carole Robertson Center for Learning in Chicago. Our mission and our vision is to really focus on the most under-resourced, underserved populations in the city of Chicago and those communities that they live in. So in Chicago, that is our mission. But what we say to ourselves is just 10 miles from Chicago is what we call the Chicago's North Shore. Very affluent suburbs.
Yeah.
And we have to make sure that our children have the same kinds of quality experiences, the same learnings and the same opportunities as the children in Winnetka would. Right? And when you
And this is a
start
problem throughout the whole school
It-
system, right? Because
it totally
obviously
is, because of the way
children
that
in
funding
wealthier
works,
neighborhoods are
right?
getting more resources
So
and
we have to
potentially
think
better
about
education,
that.
right?
We have to think about that. But that doesn't start when they walk into kindergarten, Dr. Roach. That
It
actually
starts earlier,
starts
yes,
much
right.
earlier. And so we have to think about that fundamental question about, is early childhood a right
Yeah,
in
well,
our country,
the-
where other countries have made it a
Yeah.
right? You go to Finland, this conversation doesn't happen.
What are they doing in
right?
Finland?
So it's universal. It's universal. There's paid parental leave for a year plus, right? So
Yeah.
mom and dad are at home, or mom and, however they choose to do it. And when that child matriculates out of the house,
Yeah.
there is a high quality early childhood setting that receives them with a compensated, well-trained
So they've
workforce.
sort of extended the public school system.
That's right.
Yeah, further.
Yeah. Now
okay.
their public school system probably looks a little different.
Probably
in terms
looks
of
a little
funding,
more
right?
interesting than ours too, doesn't
but
it? Yeah.
that's really the impetus of this report, is
Yeah.
to say we have so many children who have such great potential. And what stands in the way for them to reach their potential are these gaps in what they can access in terms of
Sure.
opportunity. And those opportunities are in three buckets, right? There's the academic, there's the physical, and then there's the social and emotional well-being. And that's what we're trying to tackle through this report.
So, and at this point, we're recognizing that these are all separate entities out here that are providing these
Yeah,
services.
this is not
And
centralized.
so we're talking about coordinating them first,
Yeah.
and then maybe considering that it might be
Or
better
having
if it was
some, I'm not
centralized,
sure
right?
if it would be coordinating kind of at the ground level, but having some policies and some parameters with the infusion of resources,
Right.
You cannot do what this report is saying without the adequate funding that really does
Well,
that. And
dare
so-
I ask, has anyone estimated what this would cost?
I can tell you
from
that in Illinois,
Maine to California?
it's- I don't know what the universal national cost would be,
Yeah.
and I'm scared to calculate
Yeah.
that on my own. But I can say it's a lot.
Yeah.
However, the return on investment, we know this from economists who have studied early childhood,
Yeah.
for every dollar that you invest, you get to more than a $7 return.
Right.
And that ROI is, again, at the most critical sort of window. You get the best ROI when you start younger. We're trying to catch some of these problems kind of downstream, and what
Yeah.
this report and the work of early childhood does is to prevent some of those
Yeah.
things.
How do they measure that? I mean, how do they know it goes from $1 to $7? I mean, what do they?
Well, I think
what
they're
kinds of
looking-
things do
well,
they
they're,
look
they're
for?
tracking children,
Yeah.
right? It's longitudinally
Yeah.
thinking about children that Carole Robertson Center is very driven to serve, which are
Yeah.
children who have opportunity gaps,
Yeah.
right? They are not going to have access to the best schools. They don't have access to the best medical care. They don't
Right.
have best access to housing. So when the economists studied sort of the ROI, they were looking at children not just in their early years, but looking at them at age 7, looking at them in 3rd grade, looking at them in
Yeah.
high school, following them into adulthood. And
Yeah.
what we see is those early investments actually resulted in a $7 yield. And I think that's significant. That's marvelous if for every dollar we could get that kind of return. I don't know
Yeah.
which stock we're talking
no, it's,
about
it's
these
very
days,
impressive.
right?
I'm just curious about what exactly they're measuring there, but that's okay. Let's look at the other part of that. I brought up two sides of this
Yeah.
earlier. So you're talking about then moving this information forward with the student, right? So as the student gets to 1st grade, let's say 3rd grade, right? We're tracking something here, right? What are we tracking? Who gets that information, and what might they do with it?
Well,
I'm not looking at this from a
Sure.
privacy perspective here.
Right.
I just mean
Well, there
from
is that. I'm
from
glad
a
you talked about the
scientific, how do we
privacy.
use this perspective, okay?
But I think
Yeah.
there's a couple ways to use it, right?
Yeah.
I think we have to look at their educational attainment. We know that the key indicators of how a child does after 3rd grade, there are two things that we look at. It's their literacy, their reading ability,
Yeah.
and their math ability. But what we've also learned is that if they are food insecure, if they're housing insecure, that actually affects. So it's not one thing that we can look at.
Sure.
So when they get to what we try to do is to say, what are the sort of quality indicators that lead to kindergarten readiness, that lead to social emotional well-being, right? Too many to talk about here.
Yeah.
But then when they get to kindergarten, if they're coming in on track in kindergarten, how do we sustain that, right? What does it look like for that child who is coming from a highly stressed environment?
Yeah. So how do we sustain that? I mean, there are things we can do at that point? If you know that the student came out of this stressed environment and you're the teacher in second grade?
But this is what this report is saying. It is not only the teacher's burden to fix.
Yeah.
It is really thinking about systems level change, from funding to investments in how we think about all of these elements that actually led to the opportunity gap. And what your question is a very interesting and somewhat telling question, right? Yeah. That we have made it such that we're saying that it is solely the responsibility of that teacher to get that kid ready for that third grade metric.
Well, the teacher, the parent, right?
It's a combination of many things.
I mean, the village, right? But
the village.
But who are the other players here?
But the village needs resources.
Yeah.
And so if we are saying that K through 12 education is a public right and a public good, then the argument that this report and several folks in the field would say is early childhood is a public good, but it is not funded like a public good. It's
right.
not funded. So we have to think about what are the systems that we have to actually reshape
right.
to get to that.
No, I get that, and I see clearly here what the report's calling for is coordinating these things, tracking the data. I'm just wondering what kinds of solutions we would be coming up with if we were doing all that. How might a second grade class look if 5 years from now,
Sure.
if all of this were in place, as opposed to the way a second grade class looks today?
Well, I think we would probably not have as much segregated classrooms, right?
Well,
you wouldn't
we
have
discovered
as many
that problem
poor,
a long time
we wouldn't
ago,
have as
right?
many
Yeah.
poor children lumped in poor schools.
Yeah.
So I think that that's one area. But I also think the other would be just how we think through
But I'm sorry, but I mean, do we really need to do all this research to know that we shouldn't put all the poor kids in one school and
well,
all
I
the
think it's
wealthy
beyond
kids
that,
in
though,
another
right?
school?
I think it's
yeah.
so how do you solve for children who are coming to school or an early childhood program that are food insecure? How do you
Right.
think through? Those are the pieces I think that we have never thought through holistically. The way that we've tried to solve an education issue is just by focusing on the education issue. The way that we've tried to solve for the housing issue is like, let's just focus on
Right.
the housing issue. What I am saying is that we're going to continue to swim in these independent lanes, and a kid doesn't come to any setting saying, I'm just going to put my education hat on
Sure.
right now,
Okay.
right?
All right?
And so that's what we have to really think through together.
Okay, and having gone through this in more detail here, I mean, what other things do we need to consider? Anything outside of this report that's on your mind?
I think one of the biggest takeaways for me, and my participation as an author in this one. This report was unique. I'm coming from the lens of a direct service organization that actually delivers the services to the children that this report is talking about, right? But what we think about how policies and systems and funding decisions are made, it's kind of in isolation that doesn't include the beneficiary of the system or the person who is delivering the direct service of the system.
Right.
So we think about how we've gotten to places of inequity and structural challenge. Perhaps it was because we didn't include the people who were driving the change on the ground to happen and the people who were most affected by those barriers. So I think that this is where the conversation needs to actually start when you're thinking about solutions, is include the people who are living those lived experiences of what an opportunity gap looks like, and then let's include the people who see and receive the children who have those. And I think that's most exciting, and where I believe is the most opportunity to shift the paradigm and not swim in those lanes of like only advocates or only researchers get to solve and
Yeah.
get in a room and decide what's going to happen to millions of children, but rather we do it together in community.
Sounds like a good plan. That's all the time we have for our program. Thank you to Bela Moté for joining me today on the Roundtable Perspective. I'm Tom Roach. See you next time.